Now, the other issue we're discussing is the third wave. Now, amidst the ongoing pandemic, the Council of Scientific and Industrial Research has said that even if the third wave comes to the country, its intensity will be low. They said this last week. Earlier, Manindra Agrawal, a professor at IIT-Kanpur, had said that the emergence of another wave depends on the emergence of a more infectious strain, and that perhaps in 6 months it will become an endemic disease. Currently, India's numbers have been relatively low. Active cases account for less than 1% of the overall cases, and the positivity rate currently is at 2.24%. Well, to talk more about India's trajectory, we're joined by Professor Bhramar Mukherjee, health data scientist, University of Michigan, and someone who's been tracking the numbers very closely. And Professor Bhramar, you had even spoken about the second wave and warned about it at the time. Now the numbers where they stand currently and the trajectory, what do they indicate?
Yeah, so things are right now looking quite good in India, as we can see that the effective reproduction number has been hovering around 1 for a long period of time. And most of India's cases are coming from a few states, right? So, for example, out of this 30,000 cases, nearly 20,000 is being counted in Kerala. And so you have to take that in perspective. And when we are looking at models, we are looking at India and India without Kerala, and we see a consistent decline in that trajectory, which is reassuring. And also, I think that Kerala has a very good testing system, and Kerala also had a low level of seroprevalence in our last sero survey. So I think that the healthcare system are managing things well. The fatality rates are low. So I think that there are some good news here, and vaccination is accelerating. So that's another part of the good news. So I think that the trajectory with 30 to 40,000 cases, 300 to 400 deaths has been sort of a constant for a long period of time. And in our models, we do see that in the next 2 to 4 weeks, we do not see a huge blip. But of course, we have to remember that the festivals are coming. It really all depends on all of us. Even we'll talk about the United States, but even with a high degree of vaccination, we are seeing that outbreaks can happen when we are fully re-engaged in society. So not all of us can have breakthrough infections at the same time. So we have to be very cautious, but I think there is reason to be optimistic. But having said that, I think it's important to track the pandemic closely. For the last few days, for example, I'm seeing most of India's cases are coming from the southern states right now, Kerala, Tamil Nadu, Karnataka. But then we also see Mizoram, which is a small state, but consistently producing high number of cases. We also see some upticks in Goa, Jammu and Kashmir, Himachal Pradesh. So probably vacations are starting, and these are destination for a lot of tourist mobility. So we have to be really careful, because in terms of vaccination, there is still a lot of heterogeneity in Indian states.
All right. So, Professor, the main worry right now when we talk about another spike in cases is the emergence of a new variant, because, as you said, currently numbers look like they're staying manageable.
I think that there are two sides to that story. I think a lot has changed from the second wave to the now where we are now with the introduction of vaccines, right? In April or May, less than 5% of India was fully vaccinated. So there is still, and the last sero surveys showed that 21% seroprevalence in January. So still there is a huge pocket of susceptible population prior to the second wave. That situation has changed now, because the last sero survey in June and July showed 68%, right? Nearly 68% of India had antibody. And now with vaccination, we see about 27% of adults are vaccinated, and about 70% have fully vaccination, and about 70% of adults have at least received one shot. So it has changed the landscape dramatically. And so I do think that even without the Delta variant, we could have a massive spike in India when we opened up in the second, during the second wave, and we had this sense of complacency, and also the variant really added fuel to the fire. But there was a large susceptible population then, which is not the case right now. So I think we have vaccine, we have natural immunity, so we have reason to be more hopeful. But there is always this unknown, right? If a variant which is more transmissible, more lethal, immune escape, all of these properties can happen, then we are again back to the drawing board. But so far, the good news is that, yes, we have heard about waning immunity. We have heard about low efficacy against the Delta variant. But still, in protecting, every data set shows that in protecting severe disease, these vaccines are very good. So I think that that's on my hope and that optimism that the situation is not the same. We'll still have some immunity even a new variant actually emerges. So that's my hope.
Right. Professor, also some experts have even predicted that in 6 months' time, COVID could become endemic in India. Is that a fair assessment? Then there are others who have warned against, putting any sort of timeline.
Yeah, so a couple of things. One is that, how we started talking about the third wave in June. I remember, I wrote a Times of India article that there is no third wave in the horizon according to our models right now, but India should prepare for the nth wave, right? And we have not seen a third wave, though there has been a lot of data astrology out there saying that the third wave has started. And I almost want to ask which date, which hour, because it seems like some kind of not based on science prediction. So as a statistician, I think one of the downsides of being a statistician is that you try to incorporate all the uncertainties in your model. So before concluding that it is going to become an endemic, I like to really wait and watch, particularly in my experience with Michigan, right? So if we see Michigan, it's 67% people have received one shot. Still, the case counts are going up. In the United States, we see that 55% people fully vaccinated, and then we see about 64% have received at least one shot. We have been able to vaccinate 12 to 18, but still 130,000 cases happening over the last 7-day average and 2,000 deaths. So we are, before committing anything, in July, things were looking much more positive. So we have gone through such ups and downs that I would really be cautious. I'll hope that this plateau is really going to be what all of us are projecting. But at the same time, I'm not going to give this 100% certainty that this is going to happen. The thing is that for the foreseeable future, when the virus is around, we have to learn how to live with the virus, right? Our personal prevention strategies, that's very key, because public has a role to play in public health. And then also our preparedness. We have to be on high alert regardless of what happens. So I'm more concerned about how we prepare our surveillance systems, our sequencing systems, our data systems, our healthcare systems in order to stay prepared. And even if the good news comes, we should be preparing for worse news, right?
Well, speaking about the United States, let's talk about that now. And the numbers in the U.S. are so high because of reluctance to get vaccinated. There's just so much hesitancy and misinformation that's playing a big role, isn't it?
Yeah, so this is very unfortunate because we really do have a tool to fight this deadly pandemic. But there is also in the United States also, I think this is true for India. If you look at the Indian states, Kerala has vaccinated approximately 70% with one dose. But if you look at UP, Bihar, Jharkhand, Meghalaya, and Nagaland, these numbers are around 30 to 35%, right? So there is a wide heterogeneity in terms of vaccination rates. So if I just look at the countrywide average, that does not tell me the true pictures because there are these pockets of unvaccinated population. So, for example, the same thing is happening in the United States. Massachusetts, Vermont, Connecticut, all of these East Coast states are having 77% with at least one dose, 70% fully vaccinated. But then you go to North Dakota, West Virginia, you go to Georgia, Oklahoma, Tennessee, those rates drop down to 40 to 43%. And even then, these are concentrated around metros in certain population. So it has not been homogeneous. So I think that's why we are seeing this outbreak. But I also would like to remind people that we see that the deaths and hospitalizations are happening much more in the unvaccinated population. But also all of us cannot fall sick at the same time with vaccination, even with vaccination, because if you have 200 million people vaccinated, vaccines are not perfect, right? Even if 5%, 10% have breakthrough infection at the same time, that's enough to overwhelm the healthcare system, even if a small fraction is actually severe. So I think we have to use our caution.
All right, Professor, thank you so much for joining us again on the program.